Hello, and welcome back to Bond Air. I'm your host, Jesse Longo, LVT and Associate Director of Nursing at Bond. We have a very special National Veterinary Technician Week episode lined up today. I have two fantastic guests that I am so pleased and thrilled to have into the studio today. I will introduce them both one at a time so we can get their backgrounds, hear about them, but I'm thrilled. Let's get into it. Our guest number one, Sofia Vargas, LVT, obtained her license and graduated from SUNY Delhi in 2018. She recently graduated from Queens College with a bachelor's in biology and hopes of becoming a veterinarian in the near future. Before working at Bond, she worked at Blue Pearl as a surgery, neurology, and ER nurse for 3 years. Most of that time was allotted to a surgical nurse, which helped her develop a foundation and love for surgery. Sofia has taken a role as an area lead nurse at Bond to help others feel more confident in their role within the veterinary field. Her ability to hone in on peers' ability to develop their own surgical and anesthesia skills is what inspired her to become an area lead in the first place. Sofia, hello, how are you?
Hello.
Good to see you. Thank you for coming in today.
Thank you for having me.
I am so pleased. Okay, next up, this is Amanda Ramos, CVT. Has close to 10 years experience in the veterinary medicine field, graduated school in 2019 and got her certification in 2020. Started a career at a small general practice before finishing school. She's also gained experience in emergency care before joining Bond. Amanda gives the most effort training in assisting her team through all of her passion areas. Her traits and knowledge of the field have led her to the path of becoming an area lead nurse for Bond. Amanda, how are you?
Hello, I'm good.
I'm so pleased, again, to have a room full of techs. I've been interviewing a lot of doctors recently, and I feel like, it's nice to have the techs in the room, because without us, we wouldn't be interviewing these doctors, right? So to get us started, since it is National Veterinary Technician Week, and we want to talk about the great things that our technicians do, I want to kind of hear from you both. What inspired your journeys in pursuing of veterinary medicine? I know for me, vet med was something that I kind of fell into. Which I think sometimes I envy the people that are like, I knew it from the moment I stepped out of the womb, I was going to be a tech or a vet or something, or be in the animal field. But that was not me. And I would love to hear kind of from you, because I think it's always interesting for folks that haven't jumped into the field to hear, what everyone's stories are. So, Sofia, you want to get started?
Yeah. So, I had a lot of career changes, like, in high school. I wanted to be a lawyer, to be honest.
Wow.
Yeah, so I was, like, in the law program in my school, and then I realized I'm like, this is interesting, but I feel like it's not really me.
Mm-hmm.
Then I wanted to be a dentist, I wanted to be a doctor, I wanted to be a nurse, so I was just like, I don't know. And it wasn't until my aunt passed away, so I took in her dog, and that's when I was like, wow, like, I really love animals, I love this animal, and I just want to pursue something in the animal industry. And I went from there, and then I started asking people, like, what can I do? Like, can I be a veterinarian? Because I wanted to go into veterinary school.
Mm-hmm.
That was, like, the ultimate goal. And I ended up deciding, like, let me do veterinary nurse first, and then do my bachelor's in biology and see where it goes. And I've been a veterinary nurse for, like, since 2018. I don't even know how many years. It's been almost 10 years. And everything about it, I just love it. I love taking care of animals. I love seeing them come in from, like let's say, like, God forbid, like, hit by a car, and then just seeing them recover and seeing the owners happy. That makes me happy, and I'm really grateful for all that stuff. And yeah, that's pretty much, like, my timeline. And I've been doing it for a long time, and I don't see myself doing anything else.
Yeah. I love that. I love that like same like triggering event, like, kind of always happens of that one moment where all of a sudden you're like, this is my thing, this is what I want to do. And it's always, for me, I didn't realize that a technician was even a job option. Like, I thought it was pretty much just like you had to be a vet in order to, like, really practice in this field. So when I first, like, even heard what a technician was, I was like, I want to do that. Thank you, Sofia.
Yeah.
Amanda.
So yeah, when I was little, I definitely also like wanted to do veterinarian and things like that. I had an uncle that I let him know like, hey, I really wanted to become a veterinarian, and he kind of turned me down actually, and was like, that's a lot of school. It's very hard to do, and being a child that like shapes you as like, hey, I can't do this
Hmm.
when they should have been promoting me to do it. So actually in high school, I took one of those like tests where it's like what your career like aptitude
Yeah,
test.
yeah,
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 yeah.
yeah.
So I took one of those, and I actually did get a scientist and a veterinarian, and I was like, I can't do either of those things. You're like, what, 17, 18? You're like, I can't do that. So I went into culinary school, and I was actually very close to getting my pastry degree. And I was like, this is even harder. So I did that, and I was like, you know what? I really don't like this. I was like one class away from like getting my pastry degree, and I was like, let me look into this vet thing again. I really, love animals. I've always had animals growing up. And I found the vet tech program at Bergen, and I was like,
Mm,
oh, wow, I can do this, and stumbled into it, and then like never left.
yeah. Do you still bake?
No.
No.
Sometimes I apparently have a mean chocolate chip cookie recipe according to my husband, but he's biased, I believe, so I don't know.
I love that. I think that again, it speaks a lot to, I'm sure folks listening and a lot of other technicians that have started their careers of feeling, either unsure of like how to even get in or what that avenue is, or just making that career change. I mean, I went to school to be a history teacher originally.
Wow.
So definitely like the teaching stayed consistent, like that passion for that, but the like science behind it and everything that came with going to school to be a tech definitely was like a surprise to me years later when I like joined it, because I started as like a kennel attendant, as a lot of techs do. And it was kind of from that I realized what really there. I never have thought about going the full 10 yards of being a vet. Because for a plethora of reasons, of course, but I think, I love the community of techs. It's something that like it really resonates.
Yeah, I agree. I feel, first of all, you would be a great history teacher. But we're glad you're here with us
it's
anyway.
Just the look.
Yeah, but I agree. It's like, I would love to be a doctor, and my husband always pushes me. He's like, "You can do it," and I'm like, "But I love where I am. I love my team. I love just like being where I am and continuously growing and learning in the tech way, if that makes sense."
Yeah,
Like the nursing way.
Yes,
nursing way,
exactly,
yeah.
exactly. Yeah.
I think it's a good transition into a topic that I think about a lot of, especially with nurses like yourselves that have gone through, a ton of different clinic environments and have, really made things happen for yourselves in your careers. You have a lot of experience in, knowing what's most important for technicians as they kind of join on their career journey, or even when they're coming into a practice. So I guess my question is, in your opinion, what are some of the most important skills tech should have when they're going into practice? It can be anything from technical to like other like softer skills that come to mind. But I'd love to hear from you kind of like what your advice or what the essentials are for being a successful technician.
I feel like everybody does things a little differently as long as it's the right way, and like learning and grasping from other technicians, even from other clinics. I've worked at other clinics, and a lot of those technicians have showed me things that have followed me throughout my almost 10 years in this career. And it's just kind of like flexing everything, doing everything until you learn what you love and follow through with what you're doing, like pulling blood. Some people really like love hitting jugulars or like, medial saphenous, lateral saphenous. I actually do personally prefer when it's an aggressive dog hitting medial saphenous veins on them.
Satisfying.
And it's like, people are like, why would you, it's a cat. And I'm like, well, it's a dog, but you're doing a cat, like normal thing. And I'm like, yeah, but you don't think about it like that.
Yeah.
And I've, taught a lot of people that, just doing that, and they're like, wow, I'll never go back. I love doing it that way. I'm like, yeah, you gotta have to learn. It's not one, like, how do I explain? Like, put yourself in one box. Like, you don't have to do that. You can do it different ways as long as it's not hurting the pet and it's in a right way differently.
Yeah. Safe for the pet, safe for the assistant, safe for the technician.
Exactly.
Yeah. Sophia, what about you? What do you think about?
Can I say confidence?
Yeah.
Oh,
I
love that.
I think confidence is very important. When I first started off as a tech, I had a lot of knowledge in here, but not a lot of like technical knowledge. And it isn't until like I started applying myself and like over the years I developed this confidence that I can say that confidence is very important because you're treating a live animal, and I feel like if you're not 100% there, then like that can be a little scary. Obviously, like I like relying on my doctor and like on my peers if I had like a question or anything like that. But like definitely confidence, I think, is very important in this industry, in any medical industry. Because technical skills, like you also develop too on the way, but confidence is very, very important.
Yeah.
I feel like you develop confidence more too, like being more confident. Like you come into it a little bit confident, but like doing it for how long, you get more and more confidence. So that always continues to grow.
Yeah. I feel like it's overlooked how sometimes like being a nurse or getting into medicine kind of is quite a terrifying thing when you're considering kind of the weight of your actions, of what you're doing and how it's impacting, you're with these pets at their most vulnerable time, with these clients at the most vulnerable time. So it's intimidating as all heck. And I think coming in and with that knowledge and respect of like, the importance of what you're doing, building that confidence up is really key to, just being able to provide really high quality patient care. I think I always tell new techs, and I think I brought it up when all the air lead nurses started, is just like medicine is about kind of like being comfortable, being uncomfortable a lot of times. You're not going to know everything. Especially fresh out of school and into your first couple environments, being okay to ask questions, like you saying that, Sofia, is like a really, really big thing. It sticks out to me so much when I've seen techs that are just like nervous to get in trouble. They don't know something. Much rather, an individual has the confidence to ask a question, the confidence and certainty in themselves. That's like, hey, I don't know this right now. It results in much, much better patient care.
I feel like cutting that stigma of like not asking questions and being nervous to ask questions. If somebody makes you feel bad about asking questions, then they shouldn't be doing what they're doing. You should always ask questions.
Yeah. We're kind of like, we want to get away from gatekeeping skills and like spreading the love a bit. I think that's what's important right now is that, we all kind of band together in the community of vet med and technicians. There's not a lot of us in that number.
It's a small community too. I feel like everybody knows everybody or somebody knows somebody.
Exactly.
Yeah.
But like, sorry.
Go.
Going back to what I said, like I'd rather just be able to like phone a friend or like ask people around. If I've never done something before, I'm not comfortable doing it. So I'd rather just like make sure I'm doing everything at 100. Like I don't want to ruin anything, mess anything up. Like I'd rather be like 100% comfortable with what I'm doing and all that stuff.
Yeah.
So, yeah.
And for the like new techs listening to this, like any nurse that I've met, vast majority of them, obviously there's always folks in the outliers, but everyone wants to teach. Like, I think that's the biggest thing within like the nursing community is that everyone wants to help each other. A big part of our jobs is client education. So it's already baked into what we do. So it's very natural for us to want to explain, the why behind what we're doing and talk through it. And I think that's also really important to remember. Good transition. Wow, I'm so great at this. Into my question about both of your roles recently as an area lead nurse. Area lead nurse is a new role for Bond. It's something that we're really excited about to be able to provide, some really high quality training and development to our teams from nurses like yourselves. And I think it's a good question or to think about for, nurses that are developing up into different roles. And part of why, the area lead nurse role kind of started to come to be was when I was on the floor in an ER and I was looking at, career development for myself and what options were kind of out there for me. At that time, like 5 years ago, quite limited into what a technician can go to in a clinical practice while also staying on the floor. Obviously, pursuing VTS and other things were available to me. But I think what I really wanted to see growth in for myself was more leadership development and mentorship skills. And frankly, at the time, a lot of the like lead nurse positions or other nurse positions were way more administrative than they were actually kind of like on the floor practicing side by side with folks. So in the development of this role, we kind of emphasize that as still a part of it, and having that connection to the floor is really important when you're training folks. But as you've both kind of taken on this role and approached this new avenue of skill sets for yourselves, how have you kind of approached, mentoring and developing other technicians? What are kind of your what's your mental train of thought, and how are you taking it in?
So when I look at these baby techs or these interns or these new hires, I look at them and I'm like, wow, that was me once upon a time. And I just love watching them grow. Like, I remember when I saw my intern place her first catheter, she was so happy. I was like, wow, look at you. Like, you didn't think you could do it. I thought you could do it, and you did it. So, like, I was like, good for you. So I love watching these technicians grow and reaching these milestones as little as like drawing blood, which is very important. Like like drawing blood is a very big thing. I remember when I first started drawing blood, I could not hit a vein. I could not hit a vein. When I placed my first catheter, I couldn't do it. And like I had people just walk me through it. And then when I first got that catheter, I was like, I can do it. So like it's very important to have someone that can like walk you through, be patient with you, and just be there for you like in those moments, because if you have someone that is not patient and is not nice with you, then like it's not going to want to make you do your job. It's going to make you reconsider, like maybe this isn't the field for me. So like it's important to have a mentor that will be there for you and support you.
Yeah, I definitely feel like going off of like mentorship and stuff, I feel like being in this field for so long, you have your doubts in certain things, like definitely questioning if you should continue in this field. But at this time, it's like, it's all you know. So like this role for me is kind of like going into these other clinics. And number one, the thing I feel like what separates us is that in my mind, I'm like, oh, Bond is so big, but we're only stuck. And I don't mean stuck as a bad way, but like we're only always in our clinic. So going to other clinics and seeing how they do things and kind of like, grasping everything their way is so, number one, fun to me, because I see a bunch of different things, because it's all different, clients and different issues and stuff like that. But also like being that mentor for them, like the mentor that I never got. And I think that that's like a big thing, especially doing what we do is like, I'm not speaking for everybody here or everybody at all, but just I'm sure most of us have had that, like, should I do this anymore? Kind of like thought in their head. And I don't want that to have any effect on anybody getting into this field and growing nurses and like growing VAs from VAs to nurses and stuff like that. I want to be that mentor that I never had at all of these clinics. And honestly, I enjoy going to them and just like meeting new people and networking and, broadening my horizons on a lot of like different things for them.
Yeah, absolutely. You make a great point of kind of getting out of your comfort zone of your clinic and being in, especially, across our clinics where you're going from like one neighborhood to another. It's a completely different population of clients, a completely different kind of like we're used differently in a bunch of different communities, depending on how close we are to ERs or other general practices. Let's like really dictating the types of cases that we're getting. And I think that exposure is, really helpful to put things in perspective, especially when you're working with teams with that. You may be in a clinic where all of those nurses are 10 years out and they're super confident in their skills and they're crushing it. And then you go to another clinic where everyone's a year or two out of school and still kind of finding their footing and don't really have somebody there to kind of help lead. It's a drastic contrast in culture. So having one of you come in there and help support it makes a big difference. It does change, that perspective of, do I want to do this? Am I supported in it? To all of a sudden feeling supported. And that really does like change the whole trajectory of a lot of folks' careers, which has kind of been the case. I know when I started school, our dean kind of addressed the class and said, the average lifespan of a technician in our field is like 5 years.
How we make no money.
Yeah. And now here we are like almost a decade later and we've made a lot of progress. Different. Yeah. I mean, that was one of my questions, I think, for both of you too, is like how you both have been in the field for a while now, and I would love to see kind of like how you've seen from your own perspectives, the field change, and kind of push forward? Because I think, we're, like I said, we're in a completely different space now.
Yeah, I definitely feel like, not like trying to toot Bond's horn, but like going from other clinics to Bond is completely different in the aspect of like, I specifically my manager, I'm like, I want to grow. I don't want to be stagnant. And I love what I do, and I love what I do for Bond. And she was like, I got you, boo. Come over. And she always helps support me and push me. And I feel like she wouldn't be able to do that if it wasn't for Bond or her, people above her allowing her to do that. And I feel like a lot of other clinics, or like places that I've worked, it's like, yeah, of course, right. We'll do that for you. Yeah. And then I never see anything. I follow up and it never follows through. So I feel like Bond is changing for me specifically, Bond is changing like my idea of like being a tech and opening up so many doors for me to do what I love and follow through with what I do and making it bigger and better and continuously growing for sure.
Yeah, so that's interesting.
Agreed.
I agree. Agree. Jesse, going back to what you said earlier, I remember when I first started the tech program in Delhi, they had told me, they were just like, look to your left, look to your right.
Mm-hmm.
One of you guys is not going to graduate.
Yeah.
And I was just like, I need to graduate. I like what I do. I need
Confidence.
to graduate. Yeah, exactly.
Going back to confidence.
Yeah. So I'm like, let me prove them wrong.
Yeah, for sure.
But yeah, the veterinary industry has definitely improved. Going back to the horror stories I've heard in the past, I think that we're on a really good route. I really love our patient care here.
Definitely.
Yeah, I feel like we're very supportive in that sense. Client education is very important as well. I feel like when I came to Bond, that's when I really started talking to more clients, because you have a lot of, it wouldn't be repetitive clients. It would be
Just repeating clients.
repeating clients. Yeah. We develop more of a relationship with them because it's primary care and urgent care. We see them more often. So developing that relationship is also really
so big.
Yeah, really big in the community, and I appreciate it as well.
Yeah, it's a big change from ER. I think that's like when I first was like considering joining Bond, I like was such a diehard ER technician. I was like never slower than breakneck speed for me, because I didn't at that point. I was like so focused on developing skills that I didn't really like see the point of it, and then I kind of lost what that was, that like kind of connection to clients. And then I worked at the ASPCA, and I think that like it's a whole different clientele. They're just like so appreciative of you even existing, and I think that kind of like pushed me over the edge of like wanting to interact more with clients. So like and Bond was a place that I saw like the best of both worlds, right? Where it's like still had like some of the excitement of we can still get walk-ins, and at the time it was us and like Kimmel Steel and like all these ER trained vets that were like willing to take everything. So we're like, sure, let's do that. But no, I love both those answers, because I think there's a lot of optimism where usually in our field there's a lot of pessimism. There's still a lot to do, I think, nationally, obviously, with like recognition of title and more consistent kind of policies across states and supporting, like your local organizations and NAVTA and whatnot. But what we've seen over the past, 5 or 6 years is quite incredible.
With time.
Yes.
Time.
Yeah,
We'll get
exactly.
there.
We'll get there.
We all got to stay here and keep fighting the good fight.
Oh yeah.
Amazing. I have one question too that kind of takes us back to kind of leadership. For the techs that are listening who may be interested in pursuing kind of like leadership type roles or training development roles, things like that within their practices, what kind of advice do you have for them when they're thinking about that?
Patience. Patience is a really big one. Yeah, definitely need patience. But like I said, once you develop that patience and you train this person, once you see I guess like the outcome, you feel so rewarded, because I have some people tell me now, they're just like, Sofia, you taught me that, and I appreciate you so much for that. And I'm like, oh my God, like that feels so rewarding to me.
Definitely. I feel like also part of it is like networking and kind of like, not being like stagnant. And that's just going back to like the role of ALN and going to other clinics and stuff, and like networking and learning and, teaching and showing people and meeting new people and doing exactly what you do and what you love. definitely.
Yeah, and be ready to learn new things.
Oh yeah.
Because
Yeah.
when you go to other clinics, like people do things a certain way and you do things a certain way, and maybe their way's better or maybe your way's better, and then you can like mesh them together and figure out a new way and just go from there.
Love it. I think that those are very encouraging, inspiring words to think about, because I think, you know, it's intimidating to change something that you're so comfortable in when it comes like, you know, I'm good at being a tech, you know, I'm good at anesthesia, I'm good at triage and CPR and all of that stuff, but what else do I want to build? And going into, you know, developing team members is an intimidating one, but necessary, again, for longevity of our careers and ensuring that, you know, everyone feels supported. It's always necessary. All right. Well, this has been really fun. I have one last big question for us, because I like to always, you know, we looked in the past, we looked at our history and where we got to, and we're looking at our present. So now we're going to look to the future. When we think about the future of veterinary technician roles, how do we feel like technicians are going to be able to continue their own professional development, and advocate for their own recognition? What do you think kind of the future of that looks like, going forward, you know, 5-10 years?
I feel like there is in our role like nursing aspects and everything, but I feel like when there's doctors that are not fully doctors, what are they called? Like nurse?
PAs?
Is it?
PAs?
Oh, the physician assistants.
Yeah, stuff like that, and like, you know, working underneath doctors. I know that I was actually talking to Dr. McDougall, and she was mentioning that Ohio had just passed a law of basically allowing like nurses and technicians to kind of practice under doctors and doing things like that. And I think that that's going to be something for the future for sure for us. You know, I know that Ohio is kind of like moving forward in that way, but it's for licensed technicians and stuff like that. And that I feel like that'll also push nurses that aren't fully licensed, you know, but have the years experience to kind of get their license, because they deserve it for sure. And then kind of, you know, moving forward and going like literally right below the doctor and working underneath them and being able to do a lot of the same things.
Yeah.
I 100% agree with you. I feel like that'd be so revolutionary. That'd be really cool if we can get that title as like sort of like not a PA, but like
just like a mid-level practitioner somewhere.
Lines,
Yeah, I think it's something that comes up a lot, and I think part of that desire for that kind of growth into a mid-level comes from, you know, all of us feeling so underutilized in lots of ways. We go through so much schooling, we know so much about what we're doing, but oftentimes in practices, you know, we get kind of relegated or delegated into like one specific position that only a technician can do. But as we continue to kind of grow and push the field, I agree. I think that there's more to utilization. We just had somebody from Hills on, and we were talking to them about, you know, training technicians to become those like nutritionist consultants to clients, and being able to kind of we have so many technicians that are passionate about client education and nutrition. I mean, like recently the ACVIM started recognizing nutritionists as a specialty. So like in our field, especially as that becomes even more kind of in vogue and in trend in human medicine, I think vet med's going to really soon follow. So there's that. There are a ton of technicians that are trained in sonography to be able to take images and send over to radiologists. Is something that like all these things are things that always like were through my mind of like, it's not too distant of a future for us to start doing things like that and kind of implementing them across all of our teams.
Yeah, like specialized, just because there's, like veterinary technicians, we do a lot. Like we do like anesthesia, we do internal medicine, we do dentistry. Dentistry is a very important thing to know. I just started getting into it like since joining Vaughn. Props to that, because it's
dental x-rays.
They're hard.
They're very hard, yeah. But just like, I guess like it wouldn't be like a VTS, would it be like VTS?
It wouldn't be special. I mean, maybe because they do have the VTS
Eventually.
in like general practice, providing care. But I know that there is like a master's program that I think that just started. That's kind of setting up mid-level. But it doesn't do. I mean, having that program is one thing, but it doesn't do it as much if the states aren't recognizing that that's a position really. It's just kind of like more advanced, CE, which it's cool. It's I think necessary for things to change. People need to kind of really think outside of the box and start doing these things in order for that change to follow. So I'm really interested to see kind of like where that leads and what that does for the field. But I think the point you made, Amanda, about just like getting that licensure kind of consistent across the board is really step one in a lot of these cases, because that helps put a little bit more validity behind everyone's skills and helps us advocate for the teams and make sure that our clients know that the folks taking care of their pets have all the knowledge and are in good hands. I
feel like also like moving forward, hopefully this will put more respect on like veterinary medicine's name, if it makes any sense. Like we like they are doctors. They are actually doctors. I feel like a lot of the things that I'm seeing now online is like, oh, they're not doctors. No, they're doctors. Like, we are nurses, we are animal nurses, or we are veterinary technicians, or, however you want to say it. And they are doctors, DVMs always, so I feel like with all these things that are like changing and, growing, I feel like it'll put a lot more respect on veterinary medicine for sure. Yeah, I think a lot of it comes down to kind of educating, like to your point, educating clients of what goes into these, what we are, who we are. I remember bringing a client back to the treatment area at the A once, and she was like, "Oh my gosh, it's like a little hospital back here," and I was like, "What do you think we're doing?" So it's like, and it was like it's not. I mean, it's more so on us as a field to educate them. It's not like it's not a client's fault that she doesn't know what's all going in. It's Can't
just
get
like,
mad.
Exactly. I got a pet and I brought him to the vet and now we're here. So it's like things like that. Bringing folks back. I know like Veg has like the open treatment floor, which I think helps showcase the value. These are all the people helping support your pet. So the more that we do that, the more that we educate clients, I think the more we'll have success in that.
I 100% agree.
Yeah, because I feel like a lot of people think that all we're doing is like
magic. Woo, magic wand over their animal.
But also like petting cute little dogs every day.
Oh, yeah.
I feel like that's what
my favorite.
Everyone thinks. They're like, oh, she's with a puppy or a kitten. And I'm like, no, like
saved this animal's life 5 minutes ago. No big deal. Yeah.
Like this dog was just crashing and then we have like another appointment here for vaccines. Like it's not like I feel like veterinary technicians, doctors, veterinary industry, like we do a lot.
Yeah,
we do a lot.
Do it all.
We do it. We do it all. Yeah.
Awesome. Well, with that being said, y'all, we made it. We made it to the end. Any final thoughts, words of encouragement, things thinking about Vet Tech Week, making sure everybody feels the love.
Yeah, I feel like this is our week. I feel like we get respected every day, every week. But especially this week, it's what we deserve, and we work so hard, and everybody gets the love, and it's exactly how it should be.
Yes, agreed. Happy Veterinary Technician Appreciation Week. You guys are all appreciated. You guys do so much for the clinic. Don't stop doing what you're doing. Keep it going, and you guys are all amazing. Thank you for everything. Keep growing.
Yeah, you all help so much more than you even realize, and the world is better for it.
You're not just a nurse.
No.
Yeah, you're more than that. Agreed.
Awesome. Well, thank you. It was so nice having you both here, sharing your voices with the world, and hopefully, inspiring a bunch of technicians that are listening to this.
It's the goal.
Yep.
It's the goal. Well, thank you all, and I will be tuning in, next week, and we'll talk soon. Thanks. Bye.
Bye.